Be the moderator for this session. We have three excellent speakers. Each will present for about 20 minutes, followed by a discussion. The discussion will be in a panel form. If you were here in the morning, we will follow the same format. The speakers will move up here, and then we'll open up for questions and discussion. So this session is a continuation from the morning when we talked about FSM at the level of the city. The speakers will continue to explore tools and strategies for policymakers so that they can start thinking about FSM in a more systematic and a planned manner, ultimately so that we can provide FSM services at scale. Our three speakers will take us to various parts of the world today. The first speaker today is Isabel Blackett. Isabel is a senior sanitation specialist with the World Bank's Water and Sanitation Program. She's based in East Asia and Pacific Regional Office in Jakarta. She works in Indonesia, Timor-Leste, and Papua New Guinea, and on WSP's urban sanitation agenda, the global urban sanitation agenda. She has worked in Africa and East Asia for UNICEF, DFID, AFW, NGOs, the private sector, across basically the whole gamut. Bilateral organizations as well. Isabel will talk about diagnostic tools and guidelines for FSM based on ongoing work that she's doing in partnership with other people with WSP. Good afternoon, everybody. Don't they say that the one after lunch is one of the worst sessions, so I have to try and keep you all awake? Some of what I intended to say has already been said this morning, so for those people who were in the session this morning, I sort of apologize for a little bit of repetition, and for those who weren't there, well, you have to ask me questions afterwards if I'm missing something. The other thing is this is sort of like a promotion, this is an advertisement for the workshop on Thursday morning. I think there were several promos for it this morning, and this will continue to whet your appetite for what we're going to talk about on Thursday. Now, I don't really think I need to go through this slide at all. I mean, this was well represented this morning of why we're talking about fecal sludge, and you're all here, so I don't think you need any convincing. Albert referred in her keynote this morning to a study we completed it about 2 years ago, looking at fecal sludge management in 12 cities. And some of you will be familiar with that study, and for those of you who are not, I'll actually just do a quick overview of what we found, because that study is the sort of basis of our ongoing work. These are the cities we looked at. I think I'll put a map up this morning, but the relevance of this is we looked at huge cities of 16 million right down to 120,000 to the small city in the Philippines. So there's a very wide range. Capital cities, provincial cities, coastal cities, highland cities, and from the last column you can see a very wide range of sanitation types, sometimes 100% on-site sanitation, and in the case of Nicaragua, really quite high, no, I got it wrong, Honduras, in the case of Honduras, quite high sewage coverage. The framework that we use several tools and frameworks to do our assessment. Now this one, what we're trying to demonstrate here is how money turns into happy families, but in this sense what we mean is good sanitation. But it's hard to represent good sanitation without being biased towards one technology or another. So we just put a happy family in there. And the framework we used is to look at a service delivery assessment framework in which we look at 3 pillars, and those pillars are the enabling framework, the developing framework, and the sustaining part of the framework. And then we assessed each of them according to those bullet points there. I won't read them out. And assigned scores. We then looked at each of those parts through the sanitation service chain. So based on the scoring, here's an example of what we found. The red areas, low scoring, under 1, are really where there's nothing there. And as you can see, as you go down the chain, the situation is quite different in different parts of the chain. A lot of the cities we found quite a lot more policy around containment. That was a fairly typical finding. So that was one of the tools that we used, and I'm going to show you some of the actual outcomes later. Now, before I go into the nitty-gritty of what we found, this is the sort of top-line, big picture findings that we came up with. The first one was that sanitation, fecal sludge management in particular, seems somehow invisible. I think this has already been talked about this morning. People, decision makers, seem to see fecal sludge management as something temporary, something stopgap, something that's going to kind of go away when the slums go away. Although we found evidence that some of these services have been available through the private sector for 20 or 30 years. We also found from the documentation, and again referring to something that Alan showed you this morning, is that sewerage is the proper solution. So when you're talking to people, sewerage is what they're aiming for, generally on the whole. We hope that's changing. And despite making those statements, there was actually very little information available. But that was highly indicative in itself, because what you don't monitor, there's no information, there's no reports. It's highly unlikely you'll be managing it. And when we started looking at the outcomes, it became very clear that the outcomes of fecal sludge management were poor. And there's a few bullet points of what we found. A lot of the toilets are very hard to empty. People want them emptied, and again, I think this morning that was referred to as well, really hard to dig them out or suck them out. There was very widespread manual emptying, particularly in Africa and in South Asia. Quite a different situation in Latin America and East Asia, where we found much more unregulated vacuum tankers dumping here, there, and everywhere. So at one level, maybe a little bit more hygienic at the household level, but the end result is still gross pollution somewhere else. Sorry about that. And a lack of treatment facilities. Now, we can be fairly sure that the fecal sludge isn't being dumped safely if the town or the city doesn't have a treatment plant. Where we did find legal dumping, it was into a sewage treatment plant. Now, a sewage treatment plant doesn't usually benefit from having fecal sludge dumped in it, but I won't make a value judgment on whether that's better than open dumping. It probably is, in the short term at least. We looked at these 12 cities. They fell into 3 main categories. The first one we characterise it as poor FSM. And there you can see that there's kind of a little bit of policy and a bit of framework around the enabling environment. Typically, that is, it would be related to policy around household sanitation. And that sort of fits in line quite well with the JMP focus. And it came to developing and sustaining almost nothing. The second type, we characterise it as basic FSM, and Kampala is one example there. And there again, you have a little bit more of the framework in place. You have a certain amount of perhaps private sector activity, maybe a little bit more policy on the government side. And the third category, we call this improving FSM. And there, Mbale did a great presentation this morning, telling us in quite a lot of detail about what's happening in Dakar in Senegal. So any of you who heard that presentation, you'll know why they got a considerably improved score there. And they have a lot of pieces of the framework in place. And Palau in Indonesia and Dumaguete in the Philippines also scored fairly well. And it's rather interesting that those are the 2 cities that don't have any sewerage, so decision makers weren't distracted by the sewerage. Now, does our model work? Is it valid? So we applied the same questions to cities in Malaysia to see how they fared, based on having quite a good Bill and Melinda Gates Foundation that suggested things in Malaysia were working well. And we applied the same questions, and we found that the model basically worked, and they have their framework in place. I'm just going to very briefly go through 2 examples, a type 1 city and a type 3 city. This is Delhi in India as an example. And what you see there, at the enabling level, there is some policy around containment, empty, and transport. But as you go through the framework, very, very little expenditure. Equity doesn't really come into it because there's nothing there. Little bit of output, and then the maintenance and service expansion, those circles there, those yellow marks there, are indicative of the private sector doing, offering some services. So there can be something there, even with very little government policy. What's the consequence of that? This is an interesting diagram, particularly for Delhi. And the reason it's interesting is there's quite a high level of sewerage compared to many other cities that we were looking at. And what was kind of interesting as well, the sewerage was working quite well. So that's quite a lot better than other cities we looked at. And the sewerage was actually getting true treatment. But if you look a bit more closely, the 34% that's safely managed is only on the sewerage scheme. You look on the sewerage line and you look at the fecal sludge, actually there is no system in place and there's no management there. So at one level, you can look at the 34 and the 66 and they're not doing too badly, but it isn't due to fecal sludge management services, it's due to a better operated sewerage system. Now by contrast, isn't my here? Okay. Mike told us quite a lot of detail about what was happening in Dhaka this morning, and it was really very, very interesting. But this is a good example where there really is quite a lot of the framework in place. And here, there are still weaknesses. Here, the sustaining needs a bit of work, and clearly there's a lot of potential. When you're collecting that much sludge, there's quite a bit of potential to improve the disposal and particularly reuse. I think that should really be reuse at the end. And the question is, what are the outcomes when you look at the ship flow diagram? Perhaps they're not quite what we would expect, because these figures are actually lower than the ones from New Delhi. But if you look here, the difference between this one and New Delhi is that there is a fecal sludge management system in place, and it is the sludge from the on-site facility that's getting through and is being treated. So they have a framework, and it's a matter of then improving it. And you look at these lower lines, the brown ones going down, you can see the areas where improvements are needed. And you look at the sewer line, it's not quite as encouraging as in New Delhi, and clearly a bit of work is needed there. So that was what we did 2 years ago, and that was a secondary, I have to emphasize, this was a secondary data study, and secondary data and interviews, and was the basis of doing it. That study kind of got a good reception, and for us it was very interesting, and it was very clear we had to do more work. So I'm now going to just present a little bit about our current work, and again I'll say if you come on Thursday you'll get more details and you'll be able to play with some of the tools and actually see what we're doing. So we're looking citywide, we're not just looking at poor areas, but we're focusing in on the poor areas to be sure that whatever is developed at the citywide level is applicable and meets the needs of the poor communities. We're looking at rapid diagnostic and advocacy tools. Advocacy has come up several times, and this is really important, but the advocacy tools aren't planning tools, they're different tools. I have to say part of a motivation for this study is our World Bank colleagues said to us that very often the clients want sewerage, and they don't have the tools, the package, they don't have the experience to be able to offer them something else. Now, even if they know that something else is needed, they didn't have the information and the ability to go in and, in a sense, package a non-sewer sanitation project. So part of the way we're looking at this is something that can be used by big funding institutions to package non-sewer sanitation. And the approach, we're looking at 5 cities in detail: Lima in Peru, Santa Cruz in Libya, Hawassa in Ethiopia, sorry about that, Dhaka in Bangladesh, and Balikpapan in Indonesia. And we're doing very detailed primary, secondary data collection. We're working closely, we're not doing this all ourselves. All the other partners are here around this week. We're working with Sandec, with Emory University on their SaniPath, and the Bill and Melinda Foundation, and others too. So, come again on Thursday. So, just to emphasize, I'm just going to run through quickly some of the tools that we're using. The fecal sludge, the ship flow diagram, I think you've all seen it many times this morning, and you probably saw it before you came here. For us, this is an advocacy tool to use with decision makers, and it's already been used extensively, very often with quite interesting results. It's being rolled out by GIZ and the SuSanA network with funding from the Melinda Gates Foundation. Public health risk assessment, I've mentioned, this is work that Emory University were doing anyway, and we've kind of honed in on what they were doing to make it particularly applicable. There'll be a SaniPath FSM, a sort of mini version which particularly looks at what is happening and what is the impact of those brown flows from the ship flow diagram. So you have the ship flow diagram at the top, you have the brown flows, and the SaniPath tool should be able to help us see which of those flows are the important ones that are having an impact on public health. And these are very broadly urban sanitation planning tools. So you've seen two examples already of the service delivery assessment, and that is very much looking at the legal, institution, policy, financing aspects of the service delivery. Very, very critical. I think the fact that you're here and not in one of the technical sessions means you appreciate that how important the non-technical sides are. And those of us working in the field are continually aware that probably the blockages are much greater in this area than on the technical side. And this feeds into this morning's session around the political economy as well. And the political economy analysis. Those of you that were in this room this morning will have heard Ian Ross talking in much more detail than I am able to about political economy. You'll be hearing more about it on Thursday. But this is a way of looking at who's involved, who's benefiting, looking at formal and informal structures, and how to break through what might appear to us at first as a deadlock. How do we actually work with these institutions that don't seem to be taking FSM very seriously? And we consider this as kind of this is an important and so far quite neglected way of looking at things, very important. And to some extent, the service delivery assessment tells us what is happening. What was that? The service delivery assessment tells us what is happening and what is not happening, and the political economy analysis will be able to help us understand why it's happening or it's not happening, and give us some clues on how things can be changed. The demand analysis, well, if you're going to build a system, you need to know how much is going to be emptied. That has got very strong technical and social aspects to it. And to plan your treatment or your tanker services or whatever you're going to do, you need to know how much you're dealing with. And the reuse options. This is very much Sandek's work rather more than ours. I can't see Linda, or I'm sure some of them, there she is. Yeah. So this is not something, we see it as essential, very important, but we'll be linking with Sandek, who are very much the leaders in this area. Some of you may be familiar with WSP's economics of sanitation work. Well, we've honed that down now, and we're looking at the economics of fecal sludge management, in particular the ability to make a comparison of the economic costs and the financial costs with sewage services. And again, this is a message we've got from our colleagues in the operations side of the World Bank, is they haven't got the tools to show decision makers the difference between those two cost options, both the immediate investment costs, but the future investment and the economic returns. And if you come on Thursday, you'll find out more about that. We'll have a live presentation of that. Guy Hutton, who some of you may be familiar with, has been working on developing that. This will be a web-based tool open for anyone to use, and it's still being tested. We'll get there in the end. I was going to hide the slide, I forgot. Okay, this is how they all fit together. I'll just briefly go through that. So we see that the ship flow diagram tells us where the waste is. The SDA tells us what is being done, what is not being done. The political economy analysis tells us why that is, who is deciding and who is benefiting. The SaniPath tool will actually identify where the fecal waste is particularly a problem. And a demand analysis, how much is there and what can it be used for. So we're calling these diagnostics. These are getting the picture straight before you start rushing in to do anything. And as we go that, we will then be developing, working with others, a series of guidelines, which in a sense are going to enable us to put the diagnostics into practice. So this is an extremely important area. Lots of other people are working on it, and we will be holding hands, meeting with them, and working together. It's certainly not a standalone WSP initiative. Sorry. Okay, thank you very much. So we'll have a detailed panel discussion later, but if there are specific questions for Isabel right now, we can take a couple of questions.
I can speak from my voice.
All right.
Yeah, Isabel, it's very interesting. I'm Antoinette, former from SB. My question, I was thinking when you were presenting the SEA. Hello? How much time it takes to change all those things and how long those processes are. And if we are in that process, we would like to see progress. So my question was, do you feel the SDA is sensitive to progress? To pick up progress, for example, after a year or 2 years, how sensitive is it?
I think I best illustrate that by saying we did one for one city, and 6 months down the line, we already realized we can change the scoring, because some things have changed already. So I think you need to dig deeper into the questions behind that. But some of those questions, is there a policy? Well, the policy can appear. Certainly at the city level, that can happen. So the answer is it can be sensitive. I think a lot depends how you actually apply it. Whether you're applying it from a secondary data source or whether you're actually doing it on the ground with the stakeholders, which is the way it's supposed to be done. Is not as a secondary data study, but actually with stakeholders as a process to help them analyse what their gaps are. And when they see it's all red, the answer will be, what do we need to do next? And the same with the ship flow diagram. It says to people, what do we do? Where do we need to focus? And those two are very closely related. I hope that answers.
Excellent presentation. I represent the Government of India, Ministry of Urban Development. Coming from Delhi, the embarrassing kind of situation which is just painted for us. But in a city like a normal Indian city, which has got a population of 1 million, a number of cities in India would be. And in case we don't have a centralized sewerage network, one calculation which I just made was, if for a city of 1 million, in case the entire liquid has to be transported through these vehicles, then maybe around 50,000 vehicles will be required per day in each of these 1 million population cities. There's no system to charge the liquid. In case you don't have a sewerage,
giảm tối đa cái non
then
thì
the
còn cái an toàn này mình có thể bắt
transportation will become totally
khi bắt là bắt cái chiều này thôi, cái chiều này của em không cần hình toàn cái bắt là mấy khi nó sau đây nó sẽ quay lên bắt thì cái này thì có em đổi góc đi, ví dụ là nó thay đổi tuyến giải mình có thể đổi cái khác cho nó khác phù.
Yes, okay. I'm struggling to understand. Sorry, I probably can't hear very well. We're asking about the liquid waste.
Yeah, what the liquid transportation in case we don't have a sewerage network.
I think you put your finger on what is potentially a weakness of that diagram and how it's applied. At one stage we were calling it the sludge flow diagram, and we realised it's not about sludge, it's actually about fecally contaminated wastes. And the situation where you have combined sewers and drains and the waste, and we heard that this morning very clearly, and you have the waste draining in. It is more complicated. There's no question. And I think we need to work on how that diagram represents those pictures. Yeah. Thank you so much for that really, really interesting presentation. Isabel's work is extremely interesting because it ties a lot of work that is happening on FSM right now to operations and to actually talk about how we can use it as a tool as we design projects and programs on this very important topic. The next presenter will take us to India, Meera Mehta. Meera is a professor emeritus at SEPT University and is an international consultant with multiple organizations in urban development, water supply and sanitation, and infrastructure financing. Meera served as a director for the School of Planning at SEPT, and before she left SEPT to join USAID's Power Project and also worked with WSP in Africa. So Meera is going to talk to us about financing citywide FSM in small towns in India.
This is the work that's being done jointly. As you see, the name there is Dinesh Mehta, but it's also a team at CEPT University, and we have other colleagues, Asim, who is here. And there is some material based on this work that we have, and I think Asim will distribute in case I am able to interest you enough at the end of the presentation to look at some of that. I'm going to talk about some work that we have been doing over the last about a year or so in a few small cities in the state of Maharashtra, which is where Mumbai is situated. And it essentially focuses on exploring the possibilities of introducing integrated fecal sludge management service in areas where there is actually no sewerage system, and given the fact that the kind of capital expenditure involved in these sewerage systems, it's not likely to come for some time also. Just as a background to the situation in India, we've been working in India and looking at performance assessment across about 400 cities in Gujarat and Maharashtra, as well as working with MOUD to identify what locally in India we're referring to as service level benchmarks, which is essentially performance benchmarking of water and sanitation as well as solid waste management services. Based on data from these systems, it's interesting that about 1200 out of about 1800 cities data or 1500 cities data, that 1200 cities in fact currently have fully on-site sanitation systems, which means there is no sewerage. But there are about 370 cities which do have some sewerage systems. So there is a mixed system that is of the kind that Isabel described for Delhi, where there is sewerage prevalent, but also there is on-site sanitation. So you have a situation in India that, although till very recently, in fact, both the government of India and most state governments were advocating for only sewerage systems, but there is a move now, and that is partly reflecting. But as against that, there are a large number of cities which in fact have on-site sanitation systems, and as I think since morning we have been hearing that because of this kind of policy outlook that there is not enough attention being paid to improving the fecal sludge management or on-site sanitation systems or services in our cities. So that's something that we are really looking at. There are problems in both. There are problems on on-site sanitation systems. I don't need to repeat. I think since morning we've been hearing of these. But there are also similarly problems in sewerage systems. So the ones that I said that about 370 cities that have sewerage also have significant problems, as you can see by the statistics there. And these are statistics from what we call in India the central level agency, which is the Central Pollution Control Board. Their studies actually indicate that this is the situation. So we really have to understand that both systems currently have problems. One is of course very expensive, one is happening by default, so to say, almost. Although there are, I mean, we'll see as we go along. On a positive note, things are beginning to change, and to some extent the National Urban Sanitation Policy, which the MOUD came out with in 2008, with I think a lot of input from Water and Sanitation Program, has now started to emphasize. The recent, I think the last bullet, the recent revised manual for wastewater management by the technical agency of the Government of India also now emphasizes that there is a parallel on-site sanitation system possible, and it defines the kind of guidelines that are needed to have good on-site sanitation systems. It is in this background that we've initiated work in one of the states, as I said, Maharashtra, and we've started our work with supporting some of the cities to develop city sanitation plans, and these were plans that looked at not only on-site, it looked at wastewater management, it looked at solid waste management, it also looked at water supply, because you cannot actually talk of these systems without looking at water supply. So these city sanitation plans that we worked with 4 cities in Maharashtra, these are small cities ranging from population of 30,000 to about 80,000 population. And the whole sanitation plans were developed with a lot of interactions with the local government, diagnostic studies in the local government, looking not only at the technical part or only the services, but also looking at the institutional capacities at the local level, looking at municipal finance in great amount of detail to understand what kind of taxation is possible, what kind of revenue and capital expenditure are possible, and engaging with a large range of stakeholders in these cities to develop these plans. We've developed these plans across the whole value chain. This is something that I guess all of us know quite well now. And we also developed these plans over a 10-year time frame, so it's a long-term plan. And out of that, certain local priorities were identified. To develop these plans, we have used some of the tools that we've developed on the ongoing project that is being funded by the Bill and Melinda Gates Foundation, which focuses on setting up performance assessment systems, both for monitoring as well as for improving service. So these are the kind of tools that have been developed for city level planning exercises. We've applied, this tool is rather comprehensive, looks at, as I said earlier, water supply, wastewater and solid waste management. In this particular case, we used it for looking more at sanitation options. I think in both we were discussing the options. This morning we discussed about options related to sewerage versus on-site sanitation system. So these are the kind of things that we have done. We've linked that to looking at the municipal finances, so implication on financial aspects for the municipality to if they introduce sewerage versus on-site sanitation. Even if grants were available in either case, even then there would be significant implications on tariffs for households, and these are things that were then taken into consideration. The tool also gets into phasing of activities and so on. So it's quite a comprehensive tool. If there is, we of course don't have any workshops, so I'm not plugging for any workshop for you, everybody to come to, but these are tools that are readily available for anybody who's interested. This is the current situation that was there of septage management in these cities. Essentially, and this is very important, that it was very interesting when we tried to get the data on septage, again very different than the examples that we've been hearing of private sector playing a great role. In these cities, actually it is the local government that is providing service for, already meaning providing services for emptying your septic tanks. But when we asked the data for this to the local body, they said, oh, that data is there in complaint redressal. So this is the whole fecal sludge management is looked at as addressing complaints that households make when their system starts to overflow. And that is the perspective of the local government currently. And this is something that our whole basis of our work is moving from complaint redressal to providing a regular service to the population, to the citizens of all these small cities. Some of the other findings, I think we've been hearing this, that often the septic tanks are oversized. Although surprisingly, unlike in other cases that we've heard since morning, in these cities, septic tanks are fairly well designed. So the baffles, the chambers that are necessary are all there. Only thing is they are oversized. And the other major problem is of access to these. So the access, and access not in terms of access through the streets, but access to the septic tank itself is often lacking. Because they are oversized, they go for an 8 to 10 year cycle rather than a 3-year cycle that is generally advocated. And the major problem is, of course, in terms of disposal. Disposal does take place, unlike in Hanoi or wherever it was shown this morning. It doesn't take place in your drains, but it does take place on cities' dump yard where they do solid waste dumping also. But it happens without any treatment and obviously no reuse. So that is something that will need to be addressed. So this is just a representation of the problems that I was referring to. Essentially, the plan that we are talking of with the city is to move from all the red boxes to the green boxes below. And what are the measures that will be needed to do that in a financially sustainable manner and through a mechanism that addresses the issue of local government capacity to do it itself. So how do you get private sector guys to come in a meaningful way to provide this service? So the plan, there are about 6 to 7 elements of the fecal sludge management plan that is being developed with the city. First is refurbishment of septic tank itself, and that is mainly with respect to the cover and the providing access in terms of cover so that it can happen on a regular basis. This is something that households will most likely fund, and we'll see how that goes. Second is the more scheduled cleaning. Rather than an ad hoc and demand-based cleaning and a complaint redressal type of cleaning that happens currently, we have discussed with the local government to introduce a scheduled cleaning. And we were actually quite surprised when we were having meetings with the local elected representatives and the local technical staff. And in fact, they immediately understood this whole, this will happen on a rotational basis. And it was something that was very, very readily acceptable in terms of introducing this idea. So we are quite hopeful that this will happen. The treatment reuse is, we are developing the kind of facility that needs to be set up. We've gone, right now the idea is to go for relatively simpler technology, partly because the others, there are so many technologies being talked of, but none of them looks robust enough in terms of actual examples. And those that are a little bit there are far too expensive given the kind of capital financing that would be possible in this case. So the scheduled cleaning and the financing of this activity through taxation. This is something that again, it is rather than talk of user charges, it is being talked of as a service which will be financed through local taxation. Both the cities that we are working with have accepted this proposals. Regulatory framework has been being developed and it will be implemented. We studied the state level regulatory framework and local level for that. IEC and awareness generation it's much more for the actual regulated as a scheduled services rather than the health impacts, because that I think people are more aware of, but this is something that is likely to be necessary. We are also exploring funding options. There is a tendency to, and whole morning I have been hearing, and even yesterday when we had meetings, of discussions of how World Bank funding will come in and ADB funding will come in. But in fact, in reality, most of these cases, that kind of funding will not come in. But what will come in is likely the state government programs, or more importantly, even or equally importantly, funding possibilities from local benefactors who are interested to contribute back to their cities. In India, we have now a provision where corporate through CSR, so corporate social responsibility, there is a mandate to provide 2% of the larger companies, they have to provide 2% for CSR activities, and we are working with the cities to tap this kind of funding. And lastly, very importantly, in morning I think the person from Dakar talked of that, the city level database of the entire properties that have such septic tanks is being developed with the related MRs. Very importantly, in terms of doing this kind of activity through private sector players, so we've inquired with a set of private sectors. This is a small city, so there are not that many players inside the city, but in the given region, there are a large number of players who are likely to be interested. We've interviewed and worked with them to identify their sort of risk perceptions, their priorities also. So essentially we are trying to match what the private sector needs and what the local government needs and what the population needs, and how do you evolve appropriate contracts with this. So detailed interviews were done with them. There are 6 steps that are being followed in terms of identifying appropriate private sector option, contractual option for, and that is something that will now be in the coming months really following up. Very importantly, as I said, that this will be done through the tax rather than, and this takes away a major risk perception of the private sector, that if demand doesn't really materialize, they are not really hampered. They must provide the service and there will be performance aspects built into their contract, but the payment will be done by that is the tax will be collected by the local government and paid through an escrow account on a monthly or a quarterly basis to the private provider. So the risk management there are much more details in terms of risk management framework. So just to sum up then, the whole idea of doing these 2 cities is partly that, and I think this has again come up. Morning Eddie also raised this question about the whole quite often people are not willing to go for the IFSF option because there are no examples, the city-wide or major examples that one can sort of pose and say, yes, here, this is how you can do. And the idea of these examples that we are trying to work with these cities is essentially to create those examples and hoping that 6 months down the line, well, 1 year down the line, some of this will start happening and then we will have, and I hope that other examples like I think what Ravi described in Tripura and so on will also be available, and therefore there will be greater engagement with this. Some of the major things in terms of governance and financing that I talked of, maybe let me stop here.
Thank you. So 2 questions.
Hello, my name is George Michael. I'm What's up in London. I've seen your presentation a couple of times and I think it's amazing, it's great. And very efficient use of slides. We've got 4 slides on one. It's harder to read. My question is, I think public finance is great and interesting. I think we're trying to work on it too in other places. My question is, it seems you put a lot more risk on municipalities. Initially, maybe the private sector, maybe, you know, if I wanted into my septic tank, I'd pay the private sector, they empty. But if it's the municipality's responsibility, how well are they collecting their property taxes now? We're working municipalities in Ghana that only collect 50% and less, supposing 20% of their tax. So I just want to understand from the cities that you've looked at, yeah, what are the risks in terms of how much already their ability to generate that revenue?
About 85% plus 85 to 90%, and they are working on processes, setting up further MIS and so on to even improve. In the other city, it used to be very good. They have recently expanded, so it's gone down a bit, but we are quite confident that it will come up again. So it's not a major issue. It's not like 30-40%. It's somewhere in the range of 70 to 80% collection already. Also, I didn't get into detail, but the additional tax that will be levied. So if you look at, we keep talking of cost recovery in sanitation, which to my mind is not a proper thing, because there are so many public benefits of that. You actually need to put your general local resources into sanitation, in fact, and not talk of only cost recovery. But anyway, regardless of that, the property tax payment that the household makes, this would mean somewhere about increase of 7 to 11%. That is what we've estimated. We'll of course have to wait and see what the actual bid for the private sector is, and we'll go from there. But so it's not that much.
One more question, and can we keep it really, really brief?
Also a question on taxation. We're also looking at this in Farid or in Bangladesh. This is a practical action. We talked about a taxation approach, and the two key overwhelming factors which made us decide not to go, or for Farid or not to go for taxation, was a lack of understanding of the public of the importance of FSM and their willingness to pay a tax. And secondly, the confidence of the public that the municipality or its delegated private sector partners would be able to fulfill the demand once the taxation is raised. And that brought us to a point where we actually looked at pay-as-you-go, kind of paying on entry. So interested in understanding, what are the differences in your situation. Secondly, I didn't get a sense with the treatment, who's going to pay for the treatment plants.
Second is easier to answer. The sludge, it's a sludge drying bed facility. It's not very expensive. The capital financing will have to come from either by the local body itself or through grants. But the O&M expenditure on the treatment facility is built into the private contractor, or will be built into the private contractor, and will be funded through the tax. On the other thing we can discuss. I don't know whether there is enough time right now to give you an answer.
We can come back to it during the longer panel discussion at the end of the presentation. So our final presentation today is Peter Hawkins. Peter is the country team leader for WSP in Mozambique, and he is based in Maputo. He also works on WSP's urban sanitation agenda. Previously, Peter worked with the London School of Hygiene and Tropical Medicine, and he told me he's very proud of it.
Thank you, Nishta. Firstly, let me explain why I'm the third author on this, because I am. This is work done by my colleagues principally. Unfortunately, due to austerity measures imposed upon us, we weren't able to bring them here, so I'm presenting on behalf of them. I hope I do it justice. Okay, so the cost of poor sanitation in Mozambique, in a lot of African countries, was estimated by WSP, and we've distributed those tools to various countries around Africa. And I got back to them and I said, can you give me an estimate for Maputo City? And indeed they managed to do that. But I see my friend has put this in his presentation anyway. But the cost of poor sanitation is over 1% of GDP. When we calculated it for the city of Maputo, it was about 2%. In some countries, it's as high as 5 or 6%. It's a serious economic problem, so it's clearly something we need to do something about. I think we're well familiar with the concept of the service chain. Good sanitation, it starts at a good toilet, but it goes a lot beyond there, all the way down to treatment. It's going to cost us a lot of money. Maputo is pretty backward in terms of sanitation, and therefore we're not going to do it all at once. And so probably the most rational way to do it is to prioritize and try and hit sanitation where it's causing the most damage. But then of course, we realize that we don't actually know where it's causing the most damage, because there's very little information, and I think that's a problem that's, to greater and lesser respect present in many cities. So we set out to, okay, let's evaluate the sanitation status of the city at neighborhood by neighborhood, in about 70 neighborhoods administratively defined across the city, and develop an urban sanitation index. The city of Maputo is about 1.2 million people. It's part of a conurbation which is about twice that size overall. It has 53 neighborhoods in this central part of the conurbation. They range from, if you see, I don't know if you can see that clearly, but the lower part is the central part of the downtown part of the city, which is the kind of bottom pink corner in the map there. Very nicely laid out, tarmac streets, nice solid buildings, services and so on. But a lot of the city follows a typical unplanned pattern which the upper aerial photograph shows, and that applies to a lot of the city. Of course, the inner city areas are more densely packed than those a bit further out. There's a lot of growth going on. It's increased by more than 30% in the last 10 years. And in fact, if you look at the conurbation, generally it's increased by more than that because Maputo is already more or less saturated. There's very little more space that can be occupied. The growth rates occurring is occurring mostly in the unplanned settlements, so you're getting subdivision of plots, and it's getting more and more dense. We also know that urban poverty has increased. We don't have any decent statistics about it, but we know that that's true. That while the city is booming, poverty is also increasing. Just to give you a basic idea of the sort of facilities that people are using, as part of trying to find out what exactly was going on in Maputo, we carried out a sample survey right across the city, covering all of the different neighborhoods, nearly 1,300 households, and backed that up with some focus groups just to make sure that we weren't observing anything silly. What you see there is a little bit over half of the population using some kind of facility which uses water, either a sort of traditional flush latrine or a sort of pour flush, often without a water seal, just a diagonal pipe leading into a pit, and then improved latrines with lime pits and concrete slabs, and unimproved traditional latrines. That little yellow portion at the top there. So there's a kind of continuum from sewage, which serves 9%, to some sort of fairly decent toilets, and then some pretty awful ones at the bottom end. We don't need to explain what this is about. This is the ship flow diagram for Maputo, and we're seeing, in fact, just over half is not being properly managed. That is largely because in the outer suburbs, people still have enough room to bury their toilets and move them on. And that's over time, of course, as those areas densify, that will become less possible. So that nice big thick green arrow at the bottom is going to get thinner. And unless you do something about the other stuff, which is mostly brown, there's going to be always increasing problem. And apart from what's buried, you can see only 3% is what we estimate the sort of partial treatment of that part of the sewage, which doesn't overflow because of non-functional pumping stations, or actually gets to the treatment plant and is not illegally discharged before it gets there. Just a sort of note in passing on this diagram, it's been pointed out to us by a lot of people that it doesn't actually look at the groundwater pollution issue. In Maputo, that's not really an issue because most of the water that people use, or nearly all of the water, is provided by the utility through a pipe system. In places like Jakarta, somewhere where a lot of people are using boreholes, it's an extremely relevant issue, and that's something that has to be evaluated city by city. That's in as a kind of parenthesis. So back to the sanitation status index. The idea was to look at the whole sanitation service chain, starting from containment, so access to a toilet, whether it's a decent one, whether it's hygienic. The emptying and transport, so are there available emptying services? Can they get us up to the houses in these dense packed areas? And is it transported safely? Treatment, is it disposed in the right place, and is it properly treated? And then the complementary services, because if drainage is not working and you have flooding, then all of the sanitation which you do underground is a complete waste of time, and the floods just take it everywhere. And solid waste, because if the solid waste is clogging up the ditches, then obviously you get floods, and then the sanitation breaks down. So these are the factors that we base the index on. So there's a list, basically, that we sort of hammered out, discussing with various experts as to sort of most important factors. There was an analytic hierarchy process which I confess not to understand fully. Basically the idea is to ask expert opinion on the relative importance of different factors. Is this factor more important than that factor? And then you put it all together and crunch the numbers, and that allows you to come up with some weights to the different parameters that we were looking at. And then we arbitrarily scored them from 0 to 1 on the base of an assessment of how effective that particular aspect was. And then to build up the index, in fact the nine parameters here were based on 15 qualitative variables which we combined into 9 numeric indicators and assigned these values from 0 to 1. Then we looked at the components of the chain, the 3 components of the chain and the complementary services, and made a weighted sum out of that using the weights, and then multiplied them together to give the overall index. Why did we do that? Because the shitflow diagram tells us that, you know, as long as the thing is contained while we're moving along, that's fine. But once it falls out of the chain, you've lost it forever. That's it. It's loose in the community and wreaking havoc. So obviously, where things break down, that needs to be expressed strongly in the index. If you just add everything up using weights, that doesn't happen. Whereas if you get a very low score for a particular step of the chain, that makes the whole chain score less. And we figured that was a sensible way to do things. There are some guidelines about these, which in fact were published by OECD. Apparently these are recognized as pretty good guidelines for developing composite indicators, and those are what we use. So that's how we made up the index. So that's basically that. So what did we find? On containment, I'm sorry the way these maps have been produced, you can't actually read the keys, but basically the stripy ones are better than the plain ones. I would have done it the other way around, but never mind. So what you see is that in terms of the city as a whole, I mean, basically we're doing pretty well. In fact, the city centre, which is down at the bottom, is doing a bit less well. That's due to some sharing of toilets, which is not allowed under the JMP definition of improved sanitation. However, once you start moving down the chain, things don't look so rosy. Poor scores in quite a lot of areas on emptying and transport, particularly due to the widespread use of manual emptying, guys with buckets basically getting drunk and going down to the pits to clean them out. And also spillage during transport and illegal dumping, particularly in some of the areas sort of further away from the treatment plant, which is actually at the sort of left-hand corner there of the map, more or less along the seashore. When you get into treatment, the situation looks even worse. Because basically the treatment system in Pluto is not working properly. Complementary services are a bit better. We have quite decent solid waste collection services through micro-enterprises in the different neighbourhoods. But there are still serious issues with the functioning of the drainage system, and some of the neighbourhoods are not scoring so well on that. Putting it all together, we found about a fifth of the neighbourhoods scored under a half, which we figured was representative of areas requiring urgent intervention. And there's a bright red splodge there in the middle, which is a particular neighbourhood. It's one of the most low-lying in the city. It suffers terribly from high water table and flooding. It's often choked with rubbish, and it is actually a very unhealthy place. And that sort of, it chimes with what we know about the city, so we're thinking this makes sense. You'll see that the bottom part, again, the city centre has that hatched green, which is actually the best score we've got here. Then the kind of inner city slum area next to it is not actually doing so bad generally, although some patches where it's a bit worse. And those areas which are doing worse, we recognise as the generally worse off areas. So, what was the point of all that? One conclusion is that, and I think that's something we know, and maybe it just reconfirms that while we've been getting better at ensuring that people have toilets, and people, you know, of themselves will build them because they want them. It's not very nice open defecating in a city. But as we go further down the sanitation chain, as the goods change from being private goods, which is, you know, my own privacy and the cleanliness of my house, as they turn towards more public goods, the quality decreases because this has been something that's publicly managed by a very weak municipality. And that sort of chimes with this second point, where those parts which are private goods, which people invest in, generally are doing better than where they're public goods. The main issue, definitely, is the transport and treatment of fecal sludge. It's just not being done properly. And we're doing much better in the central area where there is a sort of a sewage system, although there's a lot of that goes straight out to sea. What we think, and indeed discussing this with the city authorities, they have responded quite energetically to this. So definitely it did have some impact on decision makers, and it helps them show, you know, which of the areas you might want to focus on first to have the greatest impact on public health. But definitely this is something to be put into the whole sack of other tools that Isabel already presented earlier on. And basically just to say that, you know, you could think of many other kinds of tools as well to put into this sack. I think it's something, a lot of people are now developing different tools. And I think we're going to have to be a bit selective and clever about maybe trying to reduce the number and find ones which are the most useful, and possibly different ones will be more useful in different situations. So I think I'll stop there. Thank you very much.
Okay, Ian Ross, Monster Policy Management. I'm interested, Peter, I haven't seen that before, thank you, very interesting. And comparing that to what Isabel presented about the service delivery assessment. So the service delivery assessment, the SDA, the colourful red, yellow, green, seems to be like a qualitative way of explaining what's happening on a city level scale, whereas what you presented is more of a quantitative way, a bit more data intensive, of explaining what's happening at sub-city level, you know, within particular wards. So that's kind of my basic understanding of it. Can you explain a bit more what the relative benefits of the two different approaches are, and, you know, if they're giving effectively the same message, which is, you know, sanitation is good here or bad there, service is good here or bad there. Can you contrast them a bit more?
Well, I think that the point is that the service delivery analysis that we're developing aims exactly to look at it from the whole city perspective, and so the response to that would be a sort of citywide thing, to better regulation, sort of general development of sanitation services, whatever, publicity campaigns. The idea of this is because, you know, I think it's quite common if you discuss these kinds of issues with city fathers, city administrations. You know, they get a bit like rabbits frozen in the headlights. You say, okay, you know, we can solve this, it only costs $5.5 billion. And then the reaction is, well, why bother? Let's not do anything. So the thought was, if you can show where things are really bad, then let's start there, and we can make an impact. And I think also, from the public health point of view, is worthwhile trying to focus in with the help of other tools like Sanitation and so on, which we've discussed.
Hi, I'm Asim from India. Thanks for the presentation. It was wonderful actually. It was good to see a urban sanitation index that talks of all the parts like stormwater, solid waste. But what I think it missed upon was you are talking of only fecal sludge management, right, for the wastewater thing. But if we go by norms, only 80 of the total water supply, 80% wastewater, and major portion is grey water. So I think this needs to be added into this framework. Otherwise, it does not make sense. You're only talking of for that of the 80%, only 30% is fecal waste. Rest is grey water. So what happens to that thing? And the effluent that is coming out of septic tank. That's a major situation in I think the Asian countries, that the effluent goes into the drains, does not go anywhere. I think that needs to be added in this framework.
Yeah, I would strongly agree with that. Grey water is an issue. There's a very interesting case I heard about in Dar es Salaam a few years ago in East Africa, where the local one neighbourhood, they got particularly fed up with all the soggy ground everywhere. They got together and actually built a very kind of rickety drainage system themselves. Just bought bits of pipe and gradually connected them together. The whole area dried out, and the annual cholera outbreaks disappeared. Now there's no causative relationship there, but it was well, maybe there was, but we don't know. But yeah, I certainly agree. I think it's partly taken account of by drainage, because urban drainage basically deals with grey water, where you don't have a sewage system to deal with it. So it's kind of partly in there. Certainly I agree, it's something that would be worth thinking about, and I would, if you're interested in this kind of approach, factor it in. Go ahead, definitely. Yes.
Let's open it up for questions for all the panelists.
Okay. Thank you all for your presentation. My name is Giacomo, I'm from IOC. I'm going to be slightly provocative here. So we have seen tools, but they can also show us what we already know. For example, the last one, the rich neighborhoods are doing better than the poorer ones. So how do we move from this to engaging with the cities to actually do something about it? Because it's not a coincidence that the poorer neighborhoods are doing worse than the richer ones. And the same also with the process. We also already know which cities are doing better than others, and we can see some elements to work. These tools show that perfectly, but how to engage with the stakeholders, how to take them along in this process of change.
I think one effective means that we've done is to work with the stakeholders to do the analysis. You don't do it for them and present it to them. Though I think that has been done with a ship flow diagram and it has had an impact. But the best thing of all, particularly the service delivery assessment, and I think the one thing Peter's presented as well, is work with them before you start it, and then get their interest in actually the results. And sometimes, like you said, we know the situation, but we don't have the evidence for it. And actually, when you have solid evidence, that can really open the eyes of decision makers, but make them realise that they're going to have to be answerable if they don't deal with it.
I presented only one tool if we are talking of tools, and that tool in fact does not stop at assessing. The step one is certainly assessing the current service level when it is developed within the Ministry of Urban Development service level benchmark framework. So the first level is what is the current situation across the whole value chain for water, wastewater, solid waste. But the step two is that what do you do? What actions are possible? That is what the model or the tool essentially gets you to look at. Step three is it asks you that if these are the actions, what are the costs of these actions? What is the phasing that you envisage? And then links it to the municipal finance framework that I talked about. So it essentially tells you a set of options that are possible to do. Each option, what will be the cost implication, what are the phasing implications, Phasing is important because it tells the local authority that does it have the capability to handle so many activities, so many projects or not. And that is how we've actually changed working with the phasing. Similarly, the whole financing, that is it possible to do all this? Is it possible to mobilize grants for so many projects? Is it possible to revise tariffs the way it's indicated in the tool? So that is the, I think that those are the kind of things that we need.
I would strongly agree that the whole issue of process and having, as my colleagues have said, active involvement from the city authorities and responsible authorities is absolutely crucial to this. I think one thing that some of the tools can do, like what I was presenting and some of the other tools, they can be a bit more fine-grained, and so you can be a bit more nuanced in your interventions when funds are very limited, which they always are. So I think prioritization is a real issue. And yeah, so not all the poor are equal. Yeah. We know the poor areas, of course we do. But we may not know that some are considerably worse off than others. And I think that's useful to know.
There are a couple of other questions. There's one at the back over there.
Hello, Danielle here from the Gates Foundation. Just, I was wondering if any of the panelists could give the municipal managers in the room a little bit more sense of practical use of the tool. So, how long would it take to, from start to finish for a particular tool? Ballpark in terms of what resources might be required, whether that's in person days or in actual dollars, and then what skills might be involved. So is this the sort of thing that a municipality could do on its own? And if not, what type of skills would they need? And if not, what are the other tools that might need to wrap around this? For example, template TORs for procuring the types of service providers that can actually help them walk through these processes.
For the tools that WSP is developing, they'll tell you that in 6 months' time, or 9 months' time, to slither out of answering. I mean, certainly, all of the work, I think, can be done by the sort of professionals that you can find in any decent-sized city. If you have at least basic resources and, yes, things like, obviously, terms of reference and descriptions will obviously be useful. But I think it's a bit too soon to say. I mean, maybe your experience in India would take things a bit further, I don't know.
Again, going back to the one tool, we have several other things, but maybe let me talk of two things. One is the performance improvement planning tool that I briefly showed glimpses of. That is something that if you are starting totally afresh in a city, it would take probably about up to 3 months. Working with a local consultant, working with the city, not city on its own. For most small cities. For a larger city, there may be internal capacity to use and do it themselves. But it's also linked to the other tool that I don't know whether to call it tool, is the performance assessment system that we've developed, which is an online system where the local governments who are the service providers enter their information every year, and the 400 local governments in Gujarat and Maharashtra, the two states, have been doing for the past 5 to 6 years, working with them, the state government. So they can do it now. That data can be entered in about 1 day, because they are all. The same data then is usable for the performance improvement planning tool. It's not very, you have to recognize that one needs to understand the city, one needs to understand the options. So it's not a mechanical device. So it takes, that time is certainly needed, but it's not enormous time. In fact, we've got, just to test this exactly, we've got other consultants working in India totally independently. They have tested this in cities in Karnataka, which is one of the southern states.
Can I suggest that we continue this and sort of maybe, is it principal can add something and then we can move on to a couple of other questions. Sorry, there's so many people raising their hands.
I was actually going to give you a dollar answer. We collected the data in Indonesia in 3 cities for around 35,000. And we did the work over, I'm looking at Brady over there, I think about 3 months total, 2 weeks per city. I think the sample sizes, maybe they should have been a little larger, but we're not talking about very long periods and we're not talking about huge amounts. And the team consisted of a local senior social scientist with assistant or 2. Ray led the technical work with assistant to do the actual observation study. So you're talking about 4, 5, 6 people maybe.
So maybe I just give you some dollars also from Maputo. We did that survey, which we calculated to be statistically representative of the city for about $25,000. Yes, it's in a ballpark to what Isabel's talking about. And it took about 2 weeks. And we had 2 professionals and about 15 students that we paid to collect the data.
There's a question in the front.
Thank you. My name is Charlie, I'm from India. My question is addressed to Ms. Blackett. I think these tools are very relevant, ma'am, for kind of work we are doing. But if you look at these tools, these are predominantly advocacy tools. And you've been in the PAN system and you've been working in the system for a long time. These tools are being evolved over the last 3-4 years. A steady 12-city study was there. But when I see the investment decisions within the investment agencies, whether it's World Bank or even JICA in India, there's hardly any project coming out. So I think we need to calibrate these tools, because if we are not able to influence our own brothers and sisters in the organization, I think we cannot expect these tools to work efficiently with practitioners who are grappling with many things, number one. Number two, whether it's Maharashtra, whether it is Tripura or any other, Karnataka, we have large World Bank projects, but we are still looking for external funding sources to finance sanitation. So there is certain amount of, I think we need smarter political advocacy tools otherwise if investment decisions are made, it's very difficult to reverse them. And countries like India, these investment decisions are made very, very quickly, and it's difficult to reverse some of these investment decisions.
Thank you for that question. I think it gets quite to the nub of a lot of things there. First of all, the shipload diagram and the service delivery assessment was someone's brainwave. I was going to say over a cup of coffee, perhaps it wasn't as quick as that. We worked on a 20-day study over a period of 2 months. That is not the basis of which you're going to persuade the World Bank to take up a new tool. So that's why we're doing this more detailed work now. And we hope at the end of the study that we're doing, which I'm explaining, we will have a much more solid tool that we do feel can be used. And I think what's really critical in doing this work is to spend a huge amount of time and energy on dissemination and training, particularly dissemination. And that ship flow diagram has got just a life of its own, and the GIZ have run away with it, and you'll hear a lot more about it. And we find, yesterday we saw a ship flow diagram for a city, I don't know if we'd even heard of the city, but someone has gone on and done it. So somehow some ideas catch on. The service delivery assessment, I think, is much more than an advocacy tool. And that's actually about prioritization, where you need to focus your efforts. And I think you need to look at your institutional framework, what's there and what's not there, so that to be sure that you're focusing in the right places and looking at the identification. So I think they're not just advocacy tools. The other tools, well, let's wait till we get them out and then we'll discuss with you more. But we're optimistic that the bank team leaders actually want them.
Let's move to this side of the room. Any questions? The back.
Thank you. My name is Wilfred from Ministry of Health, Republic of Indonesia. So I heard that your all presenter here. It's a very nice presentation, but nobody talked about health impact after the intervention. So can you give a data or quality of health impact after the intervention. Before intervention, what is the situation of health? And then after the intervention, what is the situation of health? Especially related with the disease. The disease, especially the disease, diarrheal disease for children, and so on and so on. Do you any data about that? Thank you.
Yeah, that's a very difficult but very relevant question. I think we all know that demonstrating health impacts from something like sanitation is almost impossible, actually. To take a reasonably large city and then implement improved sanitation is going to take quite a long time. It's not something you do overnight. During that time, economic development occurs, immigration occurs, emigration occurs, governments change, and so you may end up in a very much better situation after 10 years. How much of that was due to your sanitation? We can't say. What we can say is that all expert opinion, I think, is entirely unanimous that sanitation is good for health. The British Medical Association voted it the most important advance in medicine in the last 100 years. And that's a pretty knowledgeable body of experts. It's very hard to make that linear relationship, and you know, there are a number. In fact, there's an impact study that we're about to start up in Maputo for an area where we've been intervening. I don't know whether we'll come up with anything. I hope we do.
I'd just like to add that the SaniPath tool developed by Emory University is specifically to identify which particular interventions or which areas have the worst health impact, and to prioritize those interventions. And these things that what they've worked on already in some of the cities, it's not obvious the answers. They're quite surprising. So come on Thursday and find out what they're doing.
Here's one.
Hi, good evening. I'm from India. Center for Science and Advancement. My question is to my friend from India, Mia. You talked about the city sanitation plans with smaller towns and large. So I just want to know the first step was refurbishment of the septic tanks. So your first step was refurbishment of the septic tanks or the on-site sanitation systems there. So my question to you is that who is going to pay for rectifying those septic tanks? Is it the owners of the households that are going to do that? And if they are supposed to do it, how are they going to convince them? And second question is that we are talking about the fecal sludge and spawning. And some of the other participants also pointed out that we are not concentrating on what is going to happen with the effluent of the septic tanks. So we can have trucks, we can have everything in place, but what even the liquid which is coming out of septic tanks is having pathogens. So if that also goes into open drains, so what is your plan for the sanitation plans you are making for this?
On the refurbishment, luckily, as I said, that the septic tanks don't have too much problems in terms of their design. So they are more or less okay. The major problem is essentially in terms of the cover of the septic tank is missing. So the idea of refurbishment is essentially to introduce a cover, the cost of which is not much. It's about 1,000 rupees, so whatever it is in dollar terms. So this is a cost that will be met by the household. That is the plan. We'll see if that leads to a problem. We'll see how to handle that. In terms of effluent and grey water, yes, we also recognize that that is a problem. One of the cities has in fact proposed settled sewers, a small boat sewer system along with the septic management and proper septic tanks and so on. We envisage that that will happen in the slightly longer term. The first phase is to go ahead with a proper septic management plan over 3 years, and then in the longer term that may be taken up.
Can I just add a postscript to that? I'm an engineer, so I'm a bit nerdy about these things. But I mean, a septic tank was never designed to produce an effluent fit for discharge into the environment. And a lot of people, even people who call themselves sanitary engineers, actually don't know that. I've had huge arguments. I remember in Ghana with a sanitary engineer who thought, but no, a septic tank is supposed to either go into a soakaway or into, as Mira was saying, into a settled sewer system.
One last question. A comment.
There was a question or saying that how much of this tool is being used by colleagues in bank, JICA, other donor agencies, and also our city is looking, or state government looking to national government to fund large programs. I've had the privilege of working with colleagues in Dhaka, where taking forward some of the work that the study has been doing, they're actually looking forward to those tools to help them in the design going forward. That was one. And the second one is in a state in Madhya Pradesh where we're working, KW is actually taking it up and looking at supporting on-site systems. And one last point is the state of Tamil Nadu is actually actively looking at the private sector to come and finance the investment. So it's not that everyone is only looking at big national government programs. Yes, there's a time and place for everything, and yeah, I think Nishna can add more to it. Thanks.
So I would like to thank all the presenters for excellent presentations and for an excellent discussion today. I think that there were a lot of common themes across all the presentations. One being, how do we move from tools to action? And I think Ravi summed that up a little bit right now when he said that a lot of these tools are now being fed into projects and are sort of informing certain programs. So it's going to be very exciting to see what comes out of them in the next year or so. I think that another thing that sort of started to come out is that what is missing from these tools and how can we enhance them and make them more context specific, which I think the presenters addressed that during the questions, and I think that was a clear sort of comment across the board. Then I think another thing that also resonated in the morning session was this lack of data, lack of information that exists on FSM. And a lot of these tools, a lot of the studies that are going on are adding to that and will hopefully allow us to make better decisions around FSM as we move forward. So thank you so much for attending. We have